Hi, welcome back to Everyday Behavior. This is the fourth video in our series this month on sleep. In this video, we're talking about 6 risks to inadequate sleep in children. I think sometimes we think sleep is important, but we don't realize exactly how important it is. And so like we touched on one of our earlier videos, that recent research has indicated that sleep deprivation or inadequate sleep can actually mimic or look very similar to ADHD in many kids. It can lead to increased behavioral outbursts, longer duration tantrums, inattention, or hyperactive, what they call the sleep paradox, which is in adults, we tend to get tired and lethargic, and we tend to move slower when we're tired. But for children, they tend to kind of lose their impulse control the more tired they are. And so they tend to be more hyperactive or impulsive. They tend to make silly mistakes. They tend to engage in riskier behaviors. And so because of that, especially in teenagers, but young children as well, we've noticed that individuals or children who receive inadequate sleep are at increased risk of accidents and injuries. This is likely due to that impulsive or hyperactive behavior, not thinking beforehand. So that frontal lobe, this part of your brain right here, really helps you to weigh the risks of a decision or a choice. And when you're not thinking ahead of time, you might make a more impulsive decision, or you may not adequately weigh the risks or evaluate the environment to see the risks that are there. The brain also and the body tends to repair itself during sleep. This includes, how your liver functions and your stomach and that fat storage. And we know that we tend to store more fat if we are sleep deprived. And so this can lead to obesity and or type 2 diabetes, because the brain and the body is feeling like it needs to prepare, it needs to store. And so that's some of the things that could lead to some of those physical health concerns. Like I talked about, that inattention and hyperactivity, when I'm tired or before I've had my coffee, I definitely have a hard time focusing. And so it's harder for me to focus on one particular thing. I'm more easily distracted. I switch through tasks. I forget things when I'm tired or I haven't had a good night's sleep. And so having that good night's sleep helps improve that attention, that focus, that goal-directed behavior that your child needs in order to focus in the classroom. Also, when I'm tired, as all of us, we tend to be slightly more irritable. So if your child has a hard time of large tantrums in response to minor triggers, just very mild things, and they kind of fly off of the handle, that could be due to inadequate sleep. So rather than attributing some of these things like inattention, hyperactivity, weight concerns, or clumsiness, or behavioral problems, mental health concerns, learning problems to other variables, it could be as simple as improving their sleep or addressing, making sure that we're getting adequate sleep. So these bottom 2, again, are poor mental health, learning problems, memory problems. And so the first thing that you want to do to reduce this risk is know how much sleep your child needs. The second thing you want to do is to set up good sleep habits, good sleep hygiene, good sleep routines. If after you have done both of those things, you're still noticing sleep concerns, then you want to talk to your pediatrician to see, do we have some kind of structural concern, whether that's tonsils, adenoids, or some kind of structural concern, such as sleep apnea, that could be reducing the quality of sleep or the quantity of sleep that your child is getting. If we've talked to the pediatrician and we still have concerns, it may be that we need to look into a sleep study or some kind of sleep specialist to further rule that out. But 90% of your sleep concerns are going to be addressed by just getting adequate sleep and having a good sleep routine or good sleep hygiene. The actual research study on sleep you can find at the American Academy of Pediatrics. So by searching in your search engine, American Academy of Pediatrics, insufficient sleep in adolescents and young adults, It is a research article, so it's going to be a little more technical than your typical articles, but it does provide some very valuable information on insufficient sleep in young adults. Thank you for watching today. You can find additional resources or the exact link to the website that I just referenced at everydaybehaviors.com. You can also find our resources on Facebook at Everyday Behavior with Dr. Mary Ann, or you can access additional videos just like this one by subscribing below on YouTube at Everyday Behavior with Dr. Mary Ann. Thank you and have an excellent day.